I really believe that employers and providers have the ability to affect healthcare change. They're just always being pitted against each other, and Healthcare Highways has really built a platform where we partner and collaborate together, and we build these custom solutions, which is sustainable. And this also invites providers and hospital systems into the conversation when costs are going up or trending higher than expected. Let's engage them and look under the hood of where are we missing on the contract side? What can we change and improve? Or where are we having bad quality that we need to address? Where are we having care leave the system because of high wait times? They're not seeing new patients. Maybe geographically they don't have coverage. All those things are things that we can address when we partner together and collaborate as part of the healthcare delivery system. When we go through an insurance product, then the insurance company is kind of holding the cards and driving that discussion. When we partner with a high value approach from the administrator to the network with the providers and the employer, we're really problem solving as we move forward, and we're getting better every single month instead of waiting to renewal time every year where we evaluate, hey, what happened to our cost? Did it go up? How bad's the renewal? This also lets you stand on your own experience. And if you're doing a good job, then you're going to outperform trend. Trend is really a fancy word of medical inflation. But when you're a carrier-based solution, even if you're on a TPA chassis, they're evaluating how did they do from a profit and loss standpoint on their insured risk. Think about Medicare Advantage, Medicaid, fully insured. And if they miss their numbers, they're going to throw a large increase on the fully insured product, but they're also going to pass some of that on as what they call trend in the self-funded environment, in the stop loss environment, or the administrative fee environment to try to recoup as much of that loss because they have a stock price and they have to answer to that stock price. And so it has a downstream effect, even if you're not on an insured product, you're on a self-funded environment. When you're not in that environment, you're really standing on your own experience. And I think that's where we've been able to prove that you can outperform the market. And again, I always talk about the market as retail, and retail is the dominant health insurance companies that you guys all know. And so really having a focused approach is critical. Having it be integrated with an independent TPA that can deliver on that. And when I say independent, I don't care who the ownership is as much, as long as they don't own networks, PBMs, other solutions that don't allow them to be flexible. And even if they do, that they're willing to carve out those solutions, that they don't mandate that all their solutions be purchased in a procurement process. We talked a little bit in another episode around what does ASO stand for? Administrative services only. I really believe if you're looking at a payer, that's the first thing you want to evaluate is, can you pay claims the way I want you to pay them? Can you integrate with solutions that I want you to integrate with? And can you work in an a la carte fashion with all my point solutions?